Thank you very much. It's so awesome to be here, and thank you for allowing me to share this stage with you. I brought my daughter here today. She's sitting over here because I wanted her to see all the awesome people that are coming out and doing this good work. And there's so many of you, and I thank you for being here. So as Katie said, we made our t-shirts that said, "Put single payer on the table," and Max Baucus replied, "Get more police." Well, guess what, Senator Baucus? You need the police because you're the criminals. We are not committing the crime. You are committing the crime of not listening to our voice and not being responsible to the American people.
Right.
Recently, I was asked at my children's school to help facilitate a discussion about refugees. We read a book about refugees, and I was so touched because it really struck a chord with what's happening here in this country. Refugees are people who are victims of crime, who are displaced, and who are left their home. They've lost everything. We have invisible refugees walking amongst us in this country. It's the millions of people who can't get health care, who are traumatized by a system that ignores their needs. Over 1 million people in this country go into medical bankruptcy every year. Most of them had health insurance. That's a crime, and it needs to end. Everybody has a story. Everybody knows somebody who's had a problem with a health insurance company, with getting health care in this country, and I hear awful stories every day. But that is the strength of our movement. That is something that will overcome all of these corporate dollars because we have a strong story. We know the truth. For decades, we have been struggling to provide care, and we can't do it. And now it's time to speak out and tell our stories, make ourselves visible, and let them know. I believe it's our professional responsibility to stand up for our patients, and that's why we stood up to Senator Baucus the other day. Now, last night, after I got home from an awesome day with you guys, you have so much energy, it's really great. I opened up one of my favorite books, which is called Voices of Freedom. It's an oral history of the civil rights movement. And I just opened it up to a page. And the page that I opened to told the story about Selma, Alabama, and the march. And how Martin Luther King and his followers marched across the bridge, but they were turned away. They were attacked, really. And they went back to the church and they gathered, and Dr. King sent out a word and said, "We need more people." And so they sat there, and as the evening wore on, they got sadder and more dejected. But around 10 or 11 at night, there was a knock on the door, and people had chartered airplanes from New York. People had come from all over to march with them, and they did march to Selma, Alabama. And so I'm putting out the call. The time is now for civil disobedience. You need to hear our call and respond. We need to stand up as professionals on behalf of our patients and say, no more. We're not going to take it anymore. So this is about human rights and human right to health care. We started this together, and we can do it. I just want to say, we are the ones that we have been waiting for. So what do we want?